I'm sure you've heard the news. Is ginger really as healthy as you think? Could this common spice be causing you harm? Its name evokes warmth, spice, and an undeniable zing, adding a unique flavor to our culinary creations. For centuries, this unassuming root has graced our kitchens and medicine cabinets, hailed for its remarkable healing properties. From ancient Chinese medicine to modern holistic practices, ginger has been a staple. From soothing nausea to calming inflammation, ginger's benefits are widely touted. It's often the go-to remedy for an upset stomach or a sore throat. But what about the other side of the coin? While its benefits are celebrated, there are aspects of ginger that are less commonly discussed. While often perceived as a harmless home remedy, ginger can interact negatively with certain health conditions. For instance, it can affect blood clotting and may not be suitable for those on blood thinners. This exploration delves into the potential downsides of ginger consumption, particularly for individuals dealing with specific health issues. It's crucial to understand these risks to avoid unintended consequences. Knowledge is power, and understanding the full spectrum of ginger's effects empowers us to make informed decisions for our well-being. By being aware of both the benefits and the risks, we can use ginger more effectively and safely. Join us as we unravel the complexities of this ancient root, separating fact from fiction and shedding light on when ginger might not be your friend. Through scientific research and expert insights, we aim to provide a balanced view of ginger's role in health and wellness. Ginger's medicinal use dates back thousands of years, with roots in traditional Chinese and Indian medicine. These ancient cultures revered ginger for its potent healing properties and incorporated it into their daily health practices. Its pungent compounds, particularly gingerols and shogols, are responsible for its distinctive flavor and therapeutic effects. These bioactive components have been the subject of numerous studies, highlighting their role in reducing oxidative stress and inflammation. Ginger is traditionally used for nausea relief, often recommended for morning sickness, motion sickness, and post-operative nausea. Its effectiveness in these areas has made it a staple in natural medicine cabinets around the world. Reducing inflammation, its anti-inflammatory properties may help alleviate pain associated with arthritis and muscle soreness. This makes ginger a popular choice for those seeking natural alternatives to conventional pain relievers. Boosting immunity, ginger is believed to possess antiviral and antibacterial properties that can support immune function. Regular consumption of ginger can help fortify the body's defenses against common illnesses. Aiding digestion, ginger is known to stimulate digestive juices and help relieve bloating and indigestion. Its carminative properties make it an excellent remedy for those suffering from gastrointestinal discomfort. These benefits are backed by scientific studies, solidifying ginger's place as a powerful natural remedy. Research continues to uncover new potential uses for ginger, from managing blood sugar levels to improving cardiovascular health. However, as with any potent substance, understanding its limitations and potential risks is crucial. Overconsumption of ginger can lead to side effects such as heartburn or digestive issues. It's important to use ginger in moderation and consult with a healthcare provider if you have any underlying health conditions. While generally considered safe and beneficial for many, ginger can pose significant risks for individuals with certain health conditions. It's important to understand these risks to make informed decisions about its use. One major area of concern is its impact on blood clotting. Ginger's natural properties can influence how blood clots, which can be both a benefit and a risk. Ginger possesses natural blood-thinning properties, which can help improve circulation and prevent clots in some individuals. This makes it a popular choice in herbal remedies aimed at promoting heart health. However, while this can be beneficial for some, it can be detrimental for people with bleeding disorders or those taking blood-thinning medications. The interaction between ginger and these medications can lead to serious health issues. Studies suggest that ginger can increase bleeding risk, especially when consumed in large amounts or alongside blood thinners like warfarin. This is because ginger can enhance the effects of these medications, leading to an increased risk of bleeding. This increased bleeding risk can manifest in various ways, such as easy bruising, prolonged bleeding from cuts, frequent nosebleeds, and in severe cases, internal bleeding. These symptoms can be alarming and require immediate medical attention. If you have a blood clotting disorder or are taking blood thinners, it's crucial to consult your doctor before incorporating ginger into your diet. Your healthcare provider can offer personalized advice and help you weigh the benefits and risks of ginger consumption in your specific situation. Always prioritize your health and safety by seeking professional guidance. Ginger is often touted as a safe and effective remedy for pregnancy-related nausea. While it can be helpful for some expectant mothers, caution is advised. High doses of ginger during pregnancy have been linked to an increased risk of miscarriage, particularly during the first trimester. While research on ginger's safety during pregnancy is ongoing, it's best to err on the side of caution. Pregnant women should consult their healthcare provider before using ginger, especially in large amounts. Remember, every pregnancy is unique, and what works for one woman may not be suitable for another. For individuals with gallstones, ginger can exacerbate symptoms and lead to complications. Ginger stimulates the gallbladder to release bile, which can be problematic for those with gallstones. The increased bile flow can cause blockages and trigger painful gallbladder attacks. Symptoms of a gallbladder attack include intense pain in the upper right abdomen, nausea and vomiting, fever and chills. If you have gallstones or a history of gallbladder problems, it's best to avoid ginger altogether to prevent further complications. Ginger's impact on blood sugar levels is another area of concern for individuals with diabetes. While some studies suggest that ginger may help regulate blood sugar, others indicate it could potentially lower blood sugar levels too much, especially when combined with diabetes medications. This blood sugar fluctuation can lead to hypoglycemia, a condition characterized by dizziness and weakness, confusion and irritability, rapid heartbeat. If you have diabetes, it's crucial to monitor your blood sugar levels closely when consuming ginger. Consult your doctor to determine if ginger is safe for you and to adjust your medication dosage if necessary. Ginger is often marketed as a weight loss aid due to its potential to boost metabolism and reduce appetite. However, the evidence supporting these claims is limited and often contradictory. While some studies suggest that ginger may contribute to modest weight loss, others show no significant impact. Moreover, excessive ginger consumption can lead to heartburn, diarrhea, and mouth irritation. It's essential to approach ginger as a potential complement to a healthy lifestyle, not a magic bullet for weight loss. Sustainable weight management involves a balanced diet, regular exercise, and addressing underlying factors that contribute to weight gain. If you experience adverse effects from ginger or belong to a group where it's advised to limit intake, there are alternative remedies to consider. Depending on what you're trying to address, some options include, for nausea, peppermint, chamomile tea, and acupuncture can offer relief. For inflammation, turmeric, omega-3 fatty acids, and bromelain possess anti-inflammatory properties. And for digestive issues, probiotics, digestive enzymes, and fiber-rich foods can support healthy digestion. Remember, these are just a few examples, and it's crucial to consult with a healthcare professional to determine the best course of action for your specific needs. When it comes to ginger and any other natural remedy, listening to your body is paramount. Start with small amounts, and gradually increase your intake while paying close attention to how your body responds. If you experience any adverse effects, discontinue use immediately and consult your doctor. Remember, what works for one person may not work for another. Personalized care is essential, and understanding your body's unique needs is key to achieving optimal health and well-being. Despite its long history of use, research on ginger is ongoing. Scientists are continually uncovering new insights into its potential benefits and risks. Future research may provide a clearer understanding of ginger's optimal dosage for specific health conditions, its long-term effects on the body, and potential interactions with other medications and supplements. As we delve deeper into ginger's complexities, we can make more informed decisions about its use and harness its power safely and effectively. While ginger offers a plethora of health benefits, it's not a one-size-fits-all solution. This exploration highlights the importance of individualized care and seeking professional guidance. Before incorporating ginger into your diet, particularly if you have underlying health conditions or are taking medications, consult your doctor or a qualified healthcare professional. They can help you assess the potential risks and benefits based on your individual circumstances and guide you toward a safe and effective approach to incorporating ginger into your wellness routine. Remember, knowledge is power, and understanding the full spectrum of ginger's effects empowers us to make informed decisions for our health.